Hello, I'm Dr. Inman. This is a mini lecture on equine colic. Colic, or abdominal dissension or abdominal pain, is seen in children, also in horse when we have a GI tract problem. It's important to understand that the horse is a walking colon. If you look at this particular information here, the green area is the colon. The colon is huge in the horse. And essentially, when it gets plugged up, the horse is in big trouble. Very commonly, that will look like this in the horse, where the horse is going after its abdominal area. Notice, I'll bring this up if you can, where the horse is going after its abdominal area. Essentially, there's obviously a pain and discomfort there, and because of that, essentially, the horse will in fact have difficulties walking. It will kick itself, it'll squeal, it'll sweat. It's obviously in discomfort. A lot of people who know horses will be able to evaluate how the horse is feeling based on the fact that they have in fact a problem with colic. They may have had a history of colic. With the VOM technology, essentially, we're able to actually address the cause of colic. It's not because they get into sand or they get into this or they get into that. There's lots and lots of horses in an environment, essentially, and the one horse that gets that colic, basically, instead of all of them getting colic, is unique. And that is unique because there's an neuronal interference in the autonomic nervous system that occurs in and around the spinal cord that actually predisposes the animal to colic. And this is important because the real cause of colic is not that they get into sand or they get into this or that, essentially, and they get plugged up. It's because they're predisposed because of a neurological interference that's occurring in their paraspinal area. The paraspinal area in the equine, just like the human, the dog, the cat, etc., the paraspinal area is the sympathetic neuron series of the autonomic nervous system. In other words, when the sympathetic rises up due to inflammation along the spinal cord, essentially, that elevates the sympathetic, decreases the parasympathetic. It's the parasympathetic that drives the GI tract, and so when sympathetic is elevated, the parasympathetic is decreased, and so the animal's colon is running in first gear all the time and can't keep up with its demand to move food from the stomach, the jejunum, into the colon and out. So what we're able to do is we're able to actually adjust the animal with this instrument. This instrument will fire a pulse of energy at about 95 pounds of force per millisecond. The human being can only fire a pulse at about 1 pound of force per millisecond. 95 pounds, 1 pound. Also, what we can do with this, it directs an energy in a 60-degree cone of energy down into the paravertebral ganglion, which exists about that far into the horse. The actual technique we describe in the vomtech.com area, essentially, and also in Module 4 extensively. We call this somato-visceral therapy. But it looks like this as we go from side to side down the back of the horse like this, contacting the area at the paravertebral ganglion. We're about this far away from the midline of the horse instead of being on the midline, because we're not actually going through the bone of the dorsal spinous process, but putting energy right down into that switch, if you will, that neuronal switch that exists in the paravertebral ganglion from T1 to L3. It isn't any more complicated than this. There are other aspects of the autonomic nervous system therapy that we'll use, but we discuss those in Module 4 in the actual course, which we hope that you'll look at and consider becoming adept at as far as a certified veterinary chiropractor. There's another technique that we have used successfully to treat these cases, essentially, and that is, in fact, the use of a frequency-specific laser therapy. And when we have that laser therapy, what we're able to do is we're able to utilize either both of these things or one of them by themselves. Preset set here, and the actual laser is actually lasered down through the tissue. Remember, this particular laser will laser all the way through the horse, so power and penetration has nothing to do with it. The magic number is 240. 240 cycles per second resets the parasympathetic nervous system of this animal's body. It's called a sympathetic overstimulation, but by doing this, we actually reset the parasympathetic system, which then allows the colon to move effectively. And either one of these therapies can cause the animal to start passing gas within 40 seconds to 4 minutes, and allows us to go ahead then and move and rehabilitate that. It's imperative to understand that this animal doesn't just develop colic because it doesn't have anything else to do. It develops colic because it has a neurological interference, a dysautonomia in the spinal cord, and we're able to repair it with this technique. If we just move the horse around and get the poo to move through the animal's body, that basically doesn't really solve the problem. It solves the immediate symptom, but it doesn't solve the problem. So our intention is to find the problem and fix it, essentially, and keep it fixed. So an animal that continually colics needs this kind of care because, in fact, we can fix the problem and get this animal through a series of adjustments or a series of laserings to where the animal doesn't colic anymore. And that's important because the underlying problem is not what the horse is eating or getting into or the environment. The underlying problem is the animal's accumulated neurological interference in their spinal cord, and it's manifesting itself in the autonomic nervous system. The VOM technology, like no other technology in the world, uses an instrument or a laser device as a means to adjust and address dysautonomia, or the autonomic nervous system. There's no other technology that does this, essentially, in the veterinary field, and we've been teaching it for the last 20 years. I would encourage you to go to the VomTech.com website and check it out. This is called somato-visceral therapy. Essentially, it's delineated most commonly in Module 4 and also a little bit in Module 3. And we would have you look at that and consider getting certified in this technology called Certified Veterinary Chiropractitioner. I'm Dr. Inman. Thank you for watching this short video on colic, essentially, and I'd have you go to that website if you'd be so kind and check it out, and or call me if you have a question about that. Have a great day.